So I'd like to welcome everyone to the Vasculitis Foundation webinar today. Thank you so much, Dr. Banerjee, for sharing all that. I feel like your presentation already did answer some of the questions that I've seen today, but I do want to ask the questions that were submitted in advance while we start to take a look at the ones that have come in today as well. So I will start with, the first one is there a link between vertigo and vasculitis, especially when affected areas are carotid, ICA, et cetera?
Yeah, that's a great question. So, yes, there is a relation. There could be a relationship between vertigo and brain vasculitis. So, first of all, let me just clarify the term vertigo. So, when you say vertigo, it usually means that there's a spinning sensation, like a room spinning sensation. So that can be caused by involvement of the inner ear, involvement of the cranial nerves. Sometimes we use the term vertigo kind of as like lightheadedness, or as if I'm going to kind of lose consciousnness. And those kind of symptoms can be caused by involvement of the carotid arteries, as was asked in the questions. So as we showed the schematic diagram, the carotid artery, which goes up from the aorta and supplies different parts of the brain. So if there is narrowing of any part of the carotid artery, there's decreased blood supply to the brain. That can cause episodes of lightheadedness, particularly certain movements of the head, certain positions where there is like neck movements, there's kinking of the carotid artery. That exacerbate these episodes of like suddenness, for seconds. So that can happen.
Okay, thanks. I also wanted to say, just because this was in the chat, that from an audience member, that Dr. Banerjee has not defined the term CNS. So I guess they would like some clarification on that.
Sure, yeah. So CNS is like the central nervous system, which includes the brain, the meninges, and the spinal cord.
Okay, thank you. Mm-hmm. Is vasculitis related to have short-term memory loss and saying one word when you mean another? Is that vasculitis or is that something else?
Yeah, so that's a great question, and often struggle with that question on a day-to-day basis in the clinic. I would say more often than not, it is usually one of the mimics. So the things that I look at, when this, I come across this situation in the clinic is it prednisone? Is it some other medication? Am I giving medications such as gabapentin, medications such as tramadol we often give at night to help with the pain, to help with the side effects of prednisone, to help you sleep. Those things can cause symptoms that you are describing. So I would say more often it is not a direct effect of vasculitis. However, if there is active disease elsewhere in the body, like if we are dealing with very active disease in the kidneys, say lungs, etc., and we are treating you with high doses of prednisone, or we are planning to start treatment with high doses of medications, at that point of time, if you start to develop these kind of symptoms, definitely further workup should be done to check for brain involvement by vasculitis.
Well, thank you, because that also was one of my questions, so I was happy to ask it today. And the next one was, I'm struggling to sleep. I wake up a few times a night. Lack of sleep makes me even more exhausted. Is lack of sleep connected to the brain and vasculitis?
So again, another great question and a very practical question. So I would say, again, more commonly, it is associated with what we are giving to you, like prednisone. If you're not able to sleep, the first step is like, is it the prednisone causing it? First step is basically to find out, why are you not sleeping? Is it the prednisone? Is it any medication? Second thing I always ask is like, is it pain? Like inflammation in the joints? Are you in pain? And that's why you're not able to sleep. So treat those conditions. Then common things being common, is there any reason to check for things like sleep apnea. So maybe that's why you're tired, you're not able to sleep, you're waking up multiple times. So more commonly, I would say these are side effects of medications or other things which are like indirect effect of the vasculitis. Maybe there is a weight gain and resulting in sleep apnea, etc., because of the prednisone that we have in you.
Well, that makes sense. We all know about the prednisone thing. I had to actually look this one up. This person says, I have PA CNS vasculitis, and I'm in chemical remission. I have come out of remission a few times. My question is fatigue and cognitive confusion at times caused by the disease or the medication? You might have to clarify PA CNS vasculitis first.
That is primary CNS vasculitis, I think the question was.
I think it is.
Yeah. So, yeah. So again, I think it's kind of, the answer is kind of in the similar lines. Most likely, if it is happening when you're in remission, it's probably not direct vasculitis. It is probably related to other things, such as, metabolic causes, weight gain, medications, etc.
Okay. The next one is, can you talk about cognitive changes in ANCA vasculitis? I was told that small vessels do not really show on MRIs. So when they're looking for bleeds, you cannot really see the small vessel. Can you explain this, please?
Yeah, that's a good question. So we teach that to the residents, like to divide the blood vessels into 3 different types: large, medium, and small. And small vessel vasculitis, such as ANCA-associated vasculitis, affects the little blood vessels, the arterioles, the capillaries, the venules, which you cannot see by naked eye. That's why biopsy, the people with ANCA-associated vasculitis have this experience of, we get biopsies of the affected tissue. You cannot see it by brain imaging. So the question was like, when you do MRI, you cannot see the bleed, right?
Right.
So MRI is still helpful because sometimes ANCA-associated vasculitis causes inflammation of the meninges, so we can see the meningitis. Sometimes it causes inflammation of the brain parenchyma. Like it causes inflammation in the lung, like lung nodules, similar inflammation in the brain parenchyma, which can be seen by imaging. And then the CSF analysis, the cerebrospinal fluid analysis, helps to detect inflammation.
Okay, and then...
Sorry, I was just going to say that we are talking about extremely low chances of this happening in somebody with ANCA-associated vasculitis. It's like less than 5% people with ANCA-associated vasculitis have brain involvement.
Okay, and these also are similar questions. The first one is, how does the PET scan differ from the MRI in terms of seeing if there's any changes in the small blood vessels?
So you really cannot see the small blood vessels by PET or MRI. So typically we do not do PET for small vessel vasculitis, and we do not do MRI for small vessel vasculitis for detecting the blood vessels. MRI, we do CAT scans. That's more like looking at the effect, like if there is bleeding in the lung, we often do, or if there are lung nodules resulting from inflammation. But we cannot actually see the small blood vessels either by MRI or by PET scans.
Okay. And today we've gotten a lot of questions on this one subject, so I'm going to start with it. COVID. There's a lot of questions about, are these symptoms that we've talked about today, are they from COVID? Are they from our vasculitis? Does one impact the other? That seems to be a very common question tonight.
So, COVID obviously, it affects in the sense like with as we know, not only with COVID, with any infection that can cause flare of underlying vasculitis. When the body undergoes any type of stress, which could be infection, which could be other types of stress, that can bring up a flare of vasculitis. So similarly, when you have COVID, it can cause a flare of vasculitis. And also the body is going through a period of stress, and that can cause secondary fatigue, maybe cognitive issues, etc. I mean, whether the mechanism of cognitive changes in vasculitis and cognitive changes in COVID are exactly the same, I think we don't clearly know that. But specifically in our patients with vasculitis, it can cause worsening of the general health because of the stress that the body goes through.
Okay, thank you. On a different topic a little bit, how does Behcet affect the vascular system, specifically within the brain? Can it lead to any neurological symptoms?
It can. Again, neurobehcets is a known complication from Behcet's. Again, it's extremely rare, but it's well defined. It can affect the brain in different ways, like in other types of vasculitis. It can cause inflammation in the wall of the blood vessels. It can sometimes cause like blood clots in the veins of the brain, and inflammation of the brain itself. So all the different types that we talked about. Typically it is seen in people who have been diagnosed with Behcet for a few years and associated with active disease elsewhere in the body.
Okay. And one of our audience members says, I have nerve damage from EGPA. Is this something that can affect the brain, or is brain vasculitis a separate disease itself? I thought that was a good question.
Yes, it is a very good question. So I'm assuming nerve involvement for EGPA is like peripheral nerve involvement, like probably tingling, numbness, which is not changing, or maybe motor weakness in the extremities, like in the foot or in the hand. So those things are seen in EGPA. That is peripheral nervous system involvement. So that is a different entity. Peripheral nervous system involvement is more common than central nervous system involvement. And I would not say that somebody who has peripheral nerve involvement from EGPA is at a higher risk of having central nervous system disease.
Okay. This is interesting. Does normal shrinkage of the brain in the elderly impact vasculitis?
It does not. If the question is like, if older people are more prone to develop brain involvement because of the natural brain shrinkage, the answer is no. I would not worry about that.
Yay. Okay. Is there a correlation between Alzheimer's and vasculitis that you know of?
That's a good question. I don't think there has been much research on vasculitis and Alzheimer's association.
Okay. Since I have a confirmed diagnosis of ABRA, though vasculitis is definitely part of this, it's not considered in the care of systemic vasculitis. I'm not sure what that is, so I'm asking. We can move on if that's not on our...
Yeah.
We'll have to look that one up, everybody. We'll hold that for the next set of questions. Do you have experience treating psychiatric symptoms like auditory hallucination mimicking schizophrenia with CNS vasculitis? Do these symptoms ever resolve with treatment?
They do. So this is a very good question. And in very active and severe involvement of the central nervous system or brain from vasculitis, we do see these acute changes or psychiatric manifestations. And again, just like, we talked about how we have to make sure we are not missing any mimics like infection, etc. in these situations, and usually these are like inpatient situations, people are admitted with these acute symptoms, we have to make sure that this is actually the effect of the vasculitis versus not the effect of high doses of prednisone, which can also cause these hallucinations and psychiatric manifestations. And once we rule that out, once we are sure that this is the direct effect of vasculitis, the treatment, as we would treat anybody with active severe vasculitis, like either rituximab or cyclophosphamide, or like strong immunosuppressants along with high doses of glucocorticoids and often intravenous doses of glucocorticoids, they do help with these acute psychiatric manifestations. Yeah.
Okay. This one is also interesting. Is it possible for menopause-related issues to mimic vasculitis-related issues? As patients, are there tests women should be asking for to rule out menopausal-related issues?
I mean, I guess it could. Like, I'm assuming like maybe cognitive changes, memory issues here and there. Yes, I guess, you know, if they are subacute or chronic onset, you know, those things should be ruled out before attributing it to vasculitis.
Okay, and this person says, I have primary CNS vasculitis treated with steroids. Looks like Myfortic and rituximab, confirmed via lumbar puncture neuroimaging. How long do you typically keep patients on long-term immunosuppression?
It's variable. I would say in general, we do keep people on immunosuppression at least for 18 to 24 months, sometimes longer. We do monitor periodically with imaging and other tests, and obviously clinically. And sometimes it could be longer. It may not be rituximab, but maybe the Myfortic could be continued for longer.
Okay, and this question goes back to the many questions about COVID, but is there a link between the COVID vaccine and the onset of CNS vasculitis?
So far, there has not been any study that has shown that COVID vaccine causes autoimmune conditions or vasculitis. So I would say no, like that. I guess the question is whether the vaccine causes CNS vasculitis. I don't think we have any data to say that.
Okay, and this one is, does Lyrica cause any of these symptoms, since you mentioned it at the beginning?
Yes, so Lyrica is one of the medications. Again, everybody is different. A lot of people do great on Lyrica, but Lyrica in some people can cause symptoms of like cognitive changes, lightheadedness, tiredness, etc.
And I think you kind of addressed this in your presentation about when to talk to your care team, but this person says, I have problems thinking and processing information, and I've had to reduce my work because of it. This was well before being diagnosed, but I'm currently on prednisone, Actrema, monthly infusions, and down to 40 milligrams of prednisone. I worry about brain involvement because of the thinking issues that I have.
So the question is,
I think they're asking if there's brain involvement, because they're starting to not be able to have good cognitive function and they've had to reduce their work. And I think in your presentation, you said you have to talk to your care team about all these things. But they were just talking about the different medications they were on. I guess they were wondering, is it the medications or the vasculitis? Yeah.
So so this is something you have to talk to your physician. If you have systemic vasculitis, is your vasculitis elsewhere in the body well controlled? And is there any opportunity to maybe slowly reduce the prednisone and see if that is helping any of your cognitive problems that you're having? Or if it's something else, like, are your electrolytes okay? Is your thyroid function okay? So I think this is where we have to kind of carefully go over each medication and make sure we are not missing anything which is abnormal in your basic lab work before trying to find out active vasculitis in the brain.
And I will remind everybody, we have a limited time tonight. We're trying to get to all the questions. I'm skipping over some of the questions because they are specific to your situation, and Dr. Banerjee cannot answer that question. So we will do our very best to answer as many of these as we can today, and then we're going to have a follow-up where we get more questions on a recorded question and answer time. This one of these last few that we're going to be able to get to is, does the brain deteriorate in all cases of GCA?
No, it does not. No, the brain does not deteriorate in all cases of GCA. And I just saw a question saying, does Lyrica cause vasculitis? No, it does not cause vasculitis, but it can cause symptoms such as cognitive changes, lightheadedness in some people, which looks like vasculitis. So this is one of the mimics. It does not cause vasculitis.
Okay, and thank you for clarifying that. This person, I don't know if you know, this person says, I'm having a major problem finding a neurologist. I've already suffered a subdural hematoma requiring a craniotomy. I have GCA. How do I find a neurologist specializing in vasculitis?
I think the best way would be to talk to your rheumatologist. Typically, at our institute, we work with neurologists who have special interest in vasculitis. So I think the best way would be to, reach out to your rheumatologist and ask for, suggestions.
Solid answer. And Dr. Banerjee has an early flight tomorrow morning to leave the country. So we are going to ask one more question. Can vasculitis be related to behavioral issues like restlessness? I'm not sure that's behavioral, but I understand.
So vasculitis causing restlessness, it can. And again, I think I'm going to say the same thing. If that's only symptom and your vasculitis is overall well controlled, I would look for other causes that can cause restlessness.
Well, thank you. I think everybody's just
Kathy?
yes.
Kathy, just one quick. I do want to. I know we have two parents on here who have young children with CNS vasculitis, and we didn't really get to address that. So I do want to try to address a couple of their questions kind of real quick. Could you just really, because I know you do have an early flight, Dr. Banerjee, kind of how common is CNS vasculitis in children? And are there any newer treatments out there that you know of for CNS vasculitis in children?
So it's very rare. In general, as we said, it's like 2 to 3 per million. And in children also, it's extremely rare. And the treatment is usually for acute cases, or for induction of remission. The treatment that commonly used as cyclophosphamide and rituximab, along with glucocorticoids, which is usually, depending on the severity of symptoms, high doses in the beginning, and then it's gradually reduced. I would also like to answer, I saw a comment that somebody said, I have CNS vasculitis and I have been on treatment for many years, and my doctor said I'll be on treatment forever. Yes, that could be a scenario. So that's why I just wanted to clarify my answer, that it's usually 18 to 24 months, and thereafter it's by monitoring. Sometimes we keep people on a less immunosuppression like azathioprine, mycophenolate, etc. for a longer period of time. Sometimes, depending on the severity and the response to treatment, we hold and then follow over time. But rituximab is also another medication that can be used every 6 months as a maintenance agent. The data on CNS vasculitis is not great. We do not have any clinical runs, and that's why we have this observational study open where we are collecting data. So we need to learn more about it. So it's not like it's a rule that you have to stop the drug at 2 years or you have to continue the medications for life. I think a lot depends on the severity of symptoms and response to treatment.
Thank you for clarifying that. Somebody actually asked about the observational study, also wanting to know if they didn't live in that immediate area, are they able to get in that observational study, and how would they do that?
So I can actually go to my screen again.
Sorry?
Yep,
you can share your screen.
Let's see if no, it's disabled.
Yeah, you should be able to now. I just disabled it so we could see the screen earlier.
Okay. No, I can't. But that's okay. I think the presentation will be available. So in the last slide, I have the Penn Vasculitis Center, the URL for that. So you can log in, you can check in there. It has the information of how to participate in the trial.
Okay, thank you. And for everyone, this has been recorded. We will be putting it up on the Vasculitis Foundation website so that you can reference it later. We also have logged all of your questions so that the ones that we didn't get to, which, there were, I think, about 200 people in here today. So we are sorry we didn't get to all of them. We did our best, and we are planning a follow-up question and answer that will be recorded and put on the Vasculitis Foundation website as well. So again, thank you so much, Dr. Banerjee, for giving us your time and answering the questions that are so hard for us to get if we don't specifically have a great doctor like you to answer the questions. And I'm afraid we are just out of time. Is there anything else that you would like to address before we finish up, so I give them the final details?
I think, the main, I would say the bottom line I would want to say is brain involvement. Obviously, this is something that, we all worry about. Luckily, I would say it's not that common, direct inflammation of the brain from vasculitis. But the key is, monitoring. And if you are worried about something, talk to your physician. If there is a change in a symptom or new symptom, talk to your physician so that, we can figure out together what could be the cause of the new presentation.
Thank you so much for that. And thank you to everyone for submitting your questions today. We appreciate it. We're all working to help educate each other. Thank you to Dr. Banerjee for spending your time with us today. Thank you to the Vasculitis Foundation for hosting this important webinar. Just like many of your educational webinar series, there are a few great ways to stay informed about vasculitis, and one of the best ways is to learn more about the Vasculitis Foundation by subscribing to the VFE News. It's a great newsletter. Every month the VF publishes this electronic newsletter, and you learn about the current vasculitis research and open studies and recruiting patients. So you'll get links to patient profiles, updates about the latest webinar posts on the VF website, and links to register for upcoming conferences.